Open the meeting at 7:10. This is Thursday, March 23rd, 2017. This is the North Andover Board of Health, and the meeting is now open. So we're called to order, and our first item of the agenda is the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have no public hearings on the docket for tonight, so we'll move to approval of minutes from the January 26th meeting. Those have been circulated and looked at. Larry, you have a copy, so you could make a motion to accept.
Yeah. Second?
All those in favor?
Aye.
So you can go ahead and sign those. So we will move to old business. So Brian, you have an update on Royal Crest?
Yep, I gave you guys a copy of an email that I exchanged with Ken Lania from Cornerstone Engineering regarding the waterproofing of Building 16 and Building 12. We actually scheduled to start 2 Wednesdays ago, but that happened to be the day we got the large snowstorm. So it's been pushed back. I'm going to be working with him on, once the weather clears, warms up a little bit, getting that scheduled, and they've been really good to work with, I have to admit. We've been in constant contact, keeping an eye on the weather, and unfortunately, we just got hit with this last biggest storm. So hopefully next week, we're going to touch base and pick a date, and then start the whole entire project.
And how long will that be?
4 weeks to 6 weeks. He's leaning more towards 4. Yeah,
How many buildings is that, Brian?
2 buildings. 2. Yep,
Wait, you're talking about building 12 and 16 here.
correct.
What about they have more work to do, though?
They have other buildings to do
Yes.
eventually, yes.
Yeah, that's why, when I said how long, I was referring to those other buildings. Any idea?
Okay, no, we haven't set a timeline for the entire. They've done more than half of the buildings so far. The more prominent ones with the most issues have been taken care of. These next 2, obviously, we kind of cited them for a few violations on those and some waterproofing issues, so those are the next 2 in line. But I think all in all, with the drainage work they're doing an entire site drainage project right now. Hopefully, we'll alleviate the rest of the buildings. If not, as they come up, they're going to be required to do them.
Brian? Oh, I'm sorry.
Has there been a problem, or any problems with the drainage work that they've already done on the other buildings? It appeared to be fine.
That was my question.
That was your question?
Yes, it was. I
Okay.
wanted to find out any problem, yeah.
Not that I'm aware of. It's under construction now. Everything's, for the most part, frozen. But as soon as the spring hits and things start to melt, I'm sure we'll find out real fast. But they did their entire bioretention cell where the pond was and redid all the piping. So they've done a lot of work. Hopefully this alleviates a lot of the situations we've been dealing with over the last 30 years.
Well, this has been an ongoing
This project's
project.
been going on for more than just this past season, right? It's been
Correct.
going on for
yes.
a couple of years.
Yeah.
Oh, many
Yeah.
years,
This-
many years.
So has, like what Joe said, do you know if, I'm just curious,
Yeah.
have any of the humidity problems reoccurred from, those past
Not that I'm aware of.
redos? Okay, well, you would have
Not that
heard
I'm aware
about
of.
it, yeah.
So hopefully with the work they're doing, and now with the entire site being drained properly, I think that's going to go a long way in alleviating the rest of the buildings that have had issues, but we haven't cited them for it yet.
In order to start the project, do they need the snow to melt down completely? Because in some shady areas, there's still a lot of snow in some areas.
So that's what we're going to wait and see what happens next week, and touch base next week and see if we can, kind of with the long-range forecast next week, we'll see if the weather's going to hold up and the snow's going to melt. Hopefully it does.
We'll still get more snow this weekend,
Are we?
a little bit,
Yeah.
but it's not going to help getting rid of it.
Yeah, they call it snizzle.
Snizzle?
Snow and drizzle.
Yeah.
That sounds good.
Okay.
There's a story behind that.
All right, so that start date is pending on that project on those 2 buildings.
Yes.
Then you suggested we have town physician official votes. You want to introduce that?
Yeah, I think we discussed it last meeting, and Frank had volunteered and accepted will accept the role when he's appointed, but I think we should do an official vote as a board, just to have it ironclad, and then we can give a recommendation to the town manager saying, this is who we want to be appointed as the town physician in the Board of Health. So I think a motion and a vote, just to have it documented and have it in the minutes, and have an official board vote, I think, just to cover our bases and make sure that we're all on board and everything is
So
pretty
how
much all
many
set.
people have applied for that position?
None.
None?
No, it hasn't been posted.
Oh, I
Once-
thought there was to be an ad in the paper, the Eagle
the-
Tribune.
Not for the town physician. You're
Oh.
talking about, the town nurse is posted.
Town nurse, excuse me, town
Correct.
nurse. I'm sorry.
Town nurse is posted.
Town nurse.
And I actually included some resumes in your packet for you to review after the meeting.
Now, is there an agreement between Frank and the town as far as, you know how you have a,
Not yet.
you oversee, no, I don't mean just a letter, like, you know how that you would oversee nurse practitioners and you have an agreement, or that they would work under your direct, is there anything like that with the nurse, when we finally get a nurse, or?
Well, the nurse can basically act under orders of a physician without
That's what, maybe that's.
without an agreement, you know,
Okay.
I mean, it's different, a supervisory agreement with like an advanced practice nurse, like
That's
a
it,
nurse
okay.
practitioner, a nurse anesthetist or something like that, that's different. But for a registered nurse, it's basically, I think what they're really looking for in a town physician is somebody to basically order the vaccines, and to basically have a name of somebody who's going to be
From time to time.
responsible, who'll be available for, you know, if they have a question about something, can they give a vaccine to a particular patient?
Yeah, so there are standing orders that Dr. Meehl will have to sign for the public health nurse to order her vaccine
Okay.
and
And
give
then to be able
vaccinations to.
Give the vaccine.
Correct.
Okay, thank you.
It's really just purely administrative.
Am I
You're
right?
not going to have office hours?
Yep.
No, I won't be,
We can set it up if you would like. I have a nice brand-new office.
I think we'll dispense with that.
So you want to make that motion?
Yeah. Make a motion that we take a vote to appoint Dr. Frank McMillan Jr. as our town physician in North Andover.
To recommend appointment of.
To recommend appointment
By
of.
the town manager.
I second.
Okay.
Any further discussion? You're sure you want to take that spot?
I will be
Or-
abstaining on the vote.
All right, all those in favor say aye.
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 And there's no votes and there's one abstain.
There's no no votes.
There's no votes.
Oh, okay, yeah.
0.
Okay?
Okay, we're flying along here.
Yes, we are.
So you want to go to staff updates?
Staff updates. First update, joining us tonight is our new admin, Tony Wolfenden. Welcome, Tony.
Welcome, Tony.
She has been absorbing everything like a sponge and enjoying her new role at the health department, and literally, we've been just throwing everything at her. And it's very overwhelming, but she's doing a fantastic job. Right?
Thank you.
Yeah, having a lot of fun.
She
I'm
is.
very happy to have you, thank you.
Yes, we are.
Thank you
So-
for the water.
Oh, you mother.
God bless you.
So welcome. It's been great.
Thanks.
It's a lot to learn. It's a lot to do. It's a very busy department, but it's been great. So that's our update for the staff.
What's your background, Tony? You moved from another position in town, is that correct? Or
I was the assessor's clerk.
the assessor's clerk?
Yes.
Okay.
Can you
Give a
give
lot
me a
of-
break on my taxes?
No.
I've dealt with Tony a number of years on precisely that, tax litigants. And I must say that she's been terrific to deal with. She's gone out of her way, and when I found out and heard that you were going to apply for the position that was open here, I felt pretty good about that. So.
Thanks.
Yeah, so we're definitely fortunate to have her, and it's been fantastic. The next update is the public health nurse. I included a few resumes that we received. Going to be probably reaching out to the applicants next week, set up some interviews. And we have a few really strong candidates. I think we're going to be very, very happy with getting somebody else on board from the candidates that we have. And I'll definitely keep you guys updated on that. And if you have any questions or see anything that you like or have any comments on the resumes, please let me know. I'm going to be probably meeting with Kathy on Monday to set up some times.
Now,
Hopefully either
this
next
is
week or
a-
the week after.
Full-time,
30 hours
30.
per week. Yep, 30 hours per week.
will she be shared at all with the senior center?
They will be working hand in hand with the senior center, yes. In the job description that we kind of retooled a little bit, updated it, we added in some things for public outreach, public education, and working with other town departments such as the senior center, library, school department, rec department, veterans agent, things like that, to kind of incorporate more of an outreach and more of an active role in things like that, like blood pressure clinics, glucose screenings, things like that we want to really get on board with and do as much as we can for the community.
I believe the senior center contracts for some of that work right now with one from the outside. Will this new person be taking over any of that contractual work?
If possible, that would be fantastic. That's, my intent is to have more access for everybody and to do more of those types of things in town. So that's up to the senior center whether they want to redo their contract with the VNA or if they want to eliminate it and use the public health nurse as their resource. We are open to all collaboration with all the different departments.
Does our town nurse, does she coordinate with the schools to get the vaccines into the schools, or how do they?
Sometimes, certain things, yes.
There's
Depending-
a school nurse.
Yeah.
That's
Correct.
designated
But I-
head there that
Yes.
handles some of that responsibility.
Yep. But in terms of childhood vaccinations, that's something we can definitely look into. I don't know how much was done here in the past in terms of things like tetanus or MMR or things that students would need for the upcoming school years. If there's a need, then we can definitely provide it, and that's something we will research and look into. And I can talk to Charlotte about that, find out what their overall need is, and then work with whoever we hire as a town public health nurse to see if we can meet those needs. But for the most part, it would be flu, and then things like pneumonia, shingles, things like that would be more prevalent, I think, and more of, it would fall more in their lap in terms of vaccinations, other than, tetanus, whooping cough, things like that.
As a kid, I remember waiting in line in school for all the vaccinations when I was a kid.
Yep.
The world has changed since then, Larry.
If there's a need, and we can kind of work through this as we hire the person and start doing more of these things, if there's a need, we will definitely provide it.
So the resumes we have here, is this everything you've gotten, or have you already done a first round of selections of
Those
kind
are the
of?
ones that we have right now, and those are the top. Those are the top 3 that we have.
Okay. Very good.
Okay?
Yeah, so your posted job description went out to all of us a couple of
Yes.
weeks ago?
Yep.
Okay. All right.
So that's that. Like I said, if you have any questions or have any comments, please let me know right away. Hopefully the interviews will go smoothly and we can have somebody in here relatively soon.
Yes, I think that would be good.
I know, definitely.
I know you think that would be good.
Yes.
Since we don't have a town nurse right now, the vaccines that are in our previous town nurse's office, are they under lock and key?
They are.
Because they're
Yep.
drugs. Okay.
Yep. I go in the office pretty much every day, check the temp on the fridge, and check the messages, make sure there's no outstanding messages.
Okay.
And the door is locked. So they are under lock and key.
Okay.
And that's it for the staff updates.
All right. You want to talk a little bit about senior center presentations and health fair updates,
Yes.
where we are on that?
We did a quick little presentation to the senior center on their Monday morning talk
Lecture
circuit.
series.
Yep, the lecture series. Gail had called me up on Friday, and the speaker that she had on Monday canceled. So she said, "Can you pull something together?" And I said, "Absolutely." So Michelle and I went over there, and I did a presentation on basically the roles and responsibilities of the health department and the Board of Health. And it turned into an open dialogue and discussion, literally for about an hour and a half, with a good chunk of seniors. It was very well received. They loved being able to ask questions and talk to us and find out about all the things that we do and things that the board does. They didn't know half the stuff that the health department and Board of Health were actually responsible for. So it was very eye-opening to some of them to know that we actually did things like mosquito control and beaver control. They had no idea that we were in charge of beaver trapping. So it was very eye-opening and enlightening, Great discussion. They loved it, and I asked if we could do more. They said, please, by all means. They would like to do more talks and lectures on more medical issues. So if you guys know anybody that can talk medicine or medical issues,
Talk to your town physician.
they would love to have more speakers from the Board of Health and the Health Department come back again. So just want to throw that out there and let you guys know that they would love to have any one of you stop by and give a talk on some Monday morning.
If they have a list of things that they're interested in hearing about, that would actually be great, because we could tailor it to what they want to hear.
I could see that population, like a pharmacy, safety, and
They would
storage.
love to hear about.
The lecture series is very popular.
Yes.
And it's not only seniors that are there. We have local rabbis, priests. Frank and I even spoke a year or so ago from the perspective of a cancer survivor and his physician. And that went over very well, too. By the way, yours went over well, the feedback that I got from the senior center.
Oh, good.
So I encourage anyone to go to our town's lecture series, Monday from 10 to 11:30. Again, it's just not seniors there.
Yeah.
It's for
everybody.
everyone. So good work.
Thank you. It was great to go there, and it was a little nerve-wracking. I didn't really have a lot prepared because it was last minute, but there's so much that we do as a department and as a board. There was ample material to discuss and talk about, and the questions just kept coming. So it was really good. So like I said, if there's any topics you guys feel strongly about that you want to talk about with the seniors, let me know. I will talk to Irene, find out if there's anything in particular that she is looking for, and talk to her and Gail, find out if they have something that they're really hoping to get more education on, and we can try to provide that.
Yeah, this past week, lecture series, we had reps from our town library. Now, I thought, because I use the library regularly, that I knew about most everything that the library has to offer, and I don't. And I learned an awful lot. So it's truly an educational experience. You can always learn when you go there.
Yeah.
Always.
Excellent. The next thing is there's a health fair on Monday from 9 to 2 at the senior center. So we've been asked to man a table for the health department. I have tons of resources and education materials and handouts and brochures. So Michelle and I and an intern from Merrimack College are going to go there Monday morning and set up a table and spend a few hours there and give out information and talk to anybody that wants to talk to the health department. So I'm looking forward to it. I got a lot of really good stuff from Mass Clearinghouse that deals with everything from mosquitoes and ticks to strokes to blood pressure, diabetes, emergency preparedness. I mean, the whole gamut of the things that we do to give out on Monday.
Now,
I'm looking
this
forward to that.
health fair that's coming Monday,
Yep.
that department will be very much involved and represented in.
Yep.
There'll be a lot of other people there, too, from what I understand. Can you comment on who else will be there?
I don't have a full list of the vendors, but there'll be other town departments and vendors and other agencies and other people giving out educational stuff. But yeah, it's completely full. We were the last table, so I'm really looking forward to like the Red Cross and everybody will be there. So I think it's going to be really good, really busy, very active health fair. And we're going to start to partner up with them earlier to do more and get more. Maybe partner up with a couple other agencies to expand it next year. But so I talked to Irene about it a little bit, and I think it's something we should definitely be more involved with moving forward. Good?
Sounds good.
All right. So I hope you guys can stop by on Monday morning.
A nice topic would be, a healthy gut is the key to a good life. It's true.
Frank, you give that speech.
Yeah.
Yeah.
Going to be the expert, subject matter expert.
What about healthy mouth is the start to the healthy gut?
You're absolutely right. That's right. You know you're right.
That's where it starts, right?
All right, well, very good.
Okay.
A lot of things going on.
Yeah.
So you'd like to introduce a topic about 127 Vest Way and a septic matter there, or?
Yeah, no matter. I just wanted to give you guys a heads up that I know we talked in the past where instead of having the engineer and the homeowners come into Board of Health meetings, it's costing a lot of money to get a local variance, I would just present it to you and let you know what everything we're doing. You guys had given me the authority to issue these in the past without having to have everybody come in. So it's a setback offset from the wetland to the leaching field, reduced from 100 feet down to 50. Title 5 is 50, and that's legal by the state, and our local regs have 100 feet, just to increase that buffer a little bit, but in this case, there's no other place to put it. The wetland lines are right around the property lines are right there. There's really nothing that they can do to get it further away. So I just want to give you a heads up that I will be issuing a variance under the board to cite this 50 feet from the wetlands. If you guys have any questions or want to look at the plans, I have them. If you want to have them come in, we can do
Variances that
that.
have to do with the wetland setback, there's a, something required from Conservation Commission as well, right?
Correct. They're going to be working with Conservation as well. Conservation does have a sign off on this as well. So it does meet Title 5. It just needs that one waiver from the local regulations. So if you guys have any questions or want them to come in here, I can definitely arrange that. I think this is a fairly simple one. It has been through Mill River, and they have basically okayed the plan as it's been designed. A couple minor revisions throughout the process, but I think we're all set at this point with that one minor revision or variance.
I don't remember how far the authority that we gave you, I know I asked you, I think earlier, if it included groundwater variations. I didn't think it did. Do you recall?
I don't remember. I know you guys said the variances you don't want to really see anymore. Just take care of it
That's
in-house.
pretty much a standard variance right there,
Yes.
from 100 feet to 50 feet.
Yeah, no,
Because there are
yeah.
no other options, so
Right.
it's somewhat of a no-brainer, really.
And it still does meet Title 5 in state law, which is good. But the groundwater offset, we haven't really come across that yet since we had that discussion a few months ago.
Those are the ones we tend to have the most sort of agit about, it seems like, that groundwater
Yeah.
depth and the 4 feet thing and
The 4 feet to
the
3
mounding
feet
and
or,
the.
That's
Yeah.
the last resort you want to do. That's why they've been coming in last year,
Okay.
groundwater offsets. What do you guys think?
I trust Mill River and I trust Brian. They know what they're doing. This has always taken a huge percentage of our time,
Yeah.
and with few, if any, exceptions, we let it go because it
We haven't
can be done from the perspective of the state and from the perspective of our board.
I think one of the
So-
things that they go for that type of variance for is for costs. Sometimes raising up the system that extra foot costs thousands and thousands of dollars in sand, so it's a cost-benefit analysis, I guess, and we can take those case by case, which is usually what you do. And if any more come through, I will give you guys a heads up. We can either have them come to the meeting, or we can talk about it just with Mill River and, ourselves.
It seems the one we scrutinized the most.
Yeah, because that's one of those ones that...
We spent the most time on.
Yeah. That's one of those ones that usually comes in because it's a cost factor versus a siting factor. Sometimes grading comes into play if you have to have your slopes and your requirements. If you have it up that full 4 feet, sometimes you have to put in a retaining wall, depending on how far it is off the property boundaries, and that literally just adds thousands and thousands of dollars to every
That's not
system.
the case
So,
here.
this case, no, this is, the grading's fine.
Basic.
This is just a offset reduction
Yes.
from 100 to 50 to a wetland.
Yeah.
But for future reference, if you guys want to do the groundwater offsets before you, I can have that type of variance request come before the board, and you can talk about it with the engineer, or we can do it online, or via email and things like that, if that's what you guys want to do.
I just as soon leave it like it is, have you and Mill River advise, and when in doubt, if you have any questions, then bring it in front of the board.
Or if the homeowner objects to the recommendation of the consultant, that would be the time that they would come before us as well.
Okay. It's up to you.
If the consultant says that you have to raise it up and they say, we don't want to wait, then we should hear those.
Okay.
I mean, if there's any criticism at all about, our workload, that's always been the number one item that's bothered me over the years. Well, all the time that we spend on this, and with few if any exceptions, we grant the request. The problems that we've had at times is the cost, well,
And that's where you get to
that's,
subjective
but not, you have to take it from 100 feet to 50 feet because of where the wetlands are. So that's-
Right.
Yeah.
Property lines and house and driveway and street and wetlands.
Yeah, no, with
So
the
it doesn't-
groundwater, though.
With the groundwater,
What we've.
That's a different story.
We've also challenged them if there's an alternative
Yep.
type system, not just, and that's a different
Conventional.
cost, but not just gravity.
The membranes and things like that.
The Presby system.
Yeah.
and Things like, yeah, okay. All right, so for this one, I'll leave it as is. I'll issue the approvals, I'll issue the variance. Any groundwater offset ones that come before us or come to our department, I will let you guys know ahead of time and see what you guys want to do.
Yeah.
But as you and I are on the same page when it comes to looking at the different scenarios and doing a cost-benefit analysis or an alternatives analysis, find out if a different system would be better instead of doing the groundwater reduction. We did that with the Boxford Street ones last year as well. Look at different site layouts, things like that, to get the maximum feasible compliance with Title V and local regs. So that's what we'll do from now on.
In town, do you have a sense over the, say, the past year, how many new permits you issue versus redo? I mean, is there really much new construction going on in North Andover? I mean, my sense is there isn't really a lot, but
Not as many as the repairs. The repairs are definitely more dominant in terms of numbers, but we do get the new ones coming in. We have the Wellington Way, which is 6 brand-new houses off of Boxford Street out towards the Boxford line that are 6 brand-new systems. So there are new systems that do come in and new small little developments that we are seeing, but the repairs definitely far outnumber the actual new construction.
okay.
All right.
All right.
That's all that I have on the actual agenda. A couple other things that I have just in discussion points. I know we talked about having the water department come in and do a presentation in the spring. If you guys want me to reach out to the water department to find out if they can send one of the people over to do a water treatment presentation to the board, if you guys are still up for that. Okay. Then starting with the elections, we want to have the elections done probably within the next meeting or two, and then the switch will happen as of this coming July. Keep that in line with the fiscal year.
I've already talked to everybody about that, so
Okay.
I suggested that
Okay.
next month we have election, and then it become effectively after the town meeting, so we can sort of be in line with that.
Okay. All right, perfect.
So you're talking about June 1st or July 1st?
Town meeting's May,
Town
right?
meeting is
So it'd
May,
be-
so we could have it in the June meeting, perhaps.
Incidentally, on the water treatment plant here, as I said many months ago, and that's a field that I've been very much in for many, many years, very well operated and maintained.
Yeah, so I'll reach out to the DPW, see if they can send somebody, see what they can kind of prepare, do a presentation for the board and for the community. We can watch it on NACAM. That'll be a great little educational piece.
As I was concerned, again, some time ago, of all the problems that they're having in Flint, Michigan, lead leaching out,
Yep.
high lead, particularly in children, and so I looked into it further, and things are fine here in North Andover.
Yes. Yeah, they've done the studies in all the schools, in all the municipal buildings, everything checks out in North Andover. We've done due diligence, the DEP did all the testing with Stephen Foster in all the schools and all the facilities, so that's already been done and taken care of, which is fantastic.
When do they go over the best practice management for the Northeast Mosquito District for our town?
I just
Is that-
received that via email last week.
You did, okay.
I haven't even read it yet, but I got it.
All right, so I mean,
And
we don't need
that's-
to announce every year, do we, that people have until such and such a date to send their requests in to not be sprayed?
I will look into
Opt
that.
out.
Opt out, yeah.
We're not required to announce it, but there is a proscribed date that's in state statute of March sometime, at which point someone has to send a registered letter to the town clerk's office to opt out of that.
I know the town clerk got that notification last month. I don't remember off the top of my head what all the details were. That is something that is definitely on the horizon right now, so.
Well, that cutoff date is in March.
Okay.
But from, when we talked about it before, we sort of handled it different ways. But there isn't a requirement for us to tell the entire town. There is just a specific date that's the cutoff date.
Correct. I know it was done in the past when there was the mandatory notification, and that was done, what, 2 years ago, was when it started? Yeah. So I don't think they have the mandatory notifications anymore, you're correct.
I think it's past the date now anyway. So,
May have been March 1st or 15th? I haven't read that, so I'm not really sure what the exact date on that is.
I'm sorry, Frank, what were you saying?
No, no.
Brian, is the county or the state going to look further into Lyme disease? Because that's been an issue of concern. I know and all of us have mentioned it over the years. Mosquitoes, you can see them, you can hear them, you can feel their bite, but not the tick. And the tick is this. Frank, how many people come down with Lyme disease every year? Is it 300,000, something like that? It's phenomenal.
Yeah.
And I know so many people that have had it.
It's going to be a really bad year.
And so I think that there is the money is not properly proportioned between mosquitoes and ticks. It's not.
Last year when the director spoke to us, she said, it was the new woman, she said they were going to start looking at options for control.
Yeah.
The problem is that, cost-wise, the problem is that it's a much bigger, notwithstanding all the issues involved, it's a much different control method that's tremendously more expensive. So it's not a one-for-one trade-off in terms of risk
Spraying.
control, yeah.
Yes.
So, but she did say that they were at the level of regional going to start looking at possibilities there. So maybe it's buried in the plan, at least the nugget of a start. So
I can definitely look into that. I know I did just get all of my tick identification cards and everything to start giving out. I think it's more of an education than it is a chemical control at this point. I think letting people know how to protect themselves is definitely one thing that we can work on, which I have gotten some resources to start with that. And I think getting a new nurse on board and doing some outreach on that would be a really good way to start. But the ticks are supposed to be really bad this year just because of the weather and the warmth and just the situation that we're in with the environmental factors, all contributing to a really, really bad tick season.
I had read that they are around all year.
I've been pulling ticks off my dogs all winter.
And we had also discussed, over the years, how to protect yourself from deer ticks. And basically, there's a similarity in protection with the tick and also the mosquito. Like when I work on my yard, I always long sleeve shirt, boots, long pants, spray, and
Spray is very, very important.
And then I come in the house and I take everything off and I take a shower
Okay.
and just put everything right in the wash machine.
Perfect. But yeah, your animals, your dogs, cats, well, not so much cats, but the dogs definitely will pick them up, run through the woods, run around the yard, and then bring them into your house, which you gotta definitely be
Yeah, they
careful
come in the house, mice too.
Yep. Yeah.
dogs get Lyme disease.
Yep.
Who does
Our
it?
dog had Lyme.
Really?
Dogs get Lyme disease, yeah.
Yeah.
Really? I didn't know
Our
that.
dog had Lyme disease, yeah.
Wow.
They have vaccine for dogs
Wow.
though. Dogs can get vaccinated.
And a lot of people have it, they don't even know it.
To contradict my esteemed colleague to my left, I
Where?
think he was wearing battle fatigues, a helmet, and he was running around his house with a sword.
I do have swords.
So yeah, I'm gonna be looking into tick education. I know last meeting we talked about a bill that was passed out in Arizona.
Oh, yeah, just, the bill was passed in Arizona, I think, a couple of years ago, and we're looking at it in Massachusetts, particularly the Medical Society, regarding recycling drugs. The idea came to me from Dr. Corey, who is an oncologist in Lawrence, and who mentioned something about oncology drugs being wasted. And he said, essentially, it's billions of dollars. And a good example would be somebody who has some kind of a cancer, tries a new drug to treat that cancer, and then it turns out either the drug doesn't work, or they're not tolerating it, or unfortunately their disease progresses, and there's leftover drug. And so you cannot, under current law, repurpose that drug. So that drug is basically getting discarded. And it could be thousands of dollars a pill. I had a particular example in my office with a fella who, roommate was undergoing treatment for hepatitis C, and you may know that these drugs are $1,000 a pill. He's like, I got a whole bottle in my house that's sealed, that's not expired, and he said, I don't know what to do with it. And I said, you can't legally do anything with it. You can't resell it, you can't donate it. There's no provision in the law about what to do with these drugs. And this particular bottle's worth $30,000 that somebody paid for. And there are people out there, even in Massachusetts, we have 97% healthcare coverage, but that doesn't mean everybody's got coverage for every drug. Doesn't mean that people are underinsured, and there still are some people who are uninsured. So what we're trying to do with this is to try to find a way to allow for donation of unused pharmaceuticals that would be in a certain condition. They'd be unopened, unused, unadulterated. There would be some sort of provision to have a pharmacist to certify that the drug wasn't tampered with and that it was what it says it is, and then find some way to be able to allow that drug to be used by somebody else with informed consent and be directed so that it wouldn't have to be thrown away and wasted. Again, we're talking potentially billions of dollars. So right now, the Dr. Corey submitted an item to the Massachusetts Medical Society for their annual meeting, and they're going to see if we can get some traction on how to best approach this. And once we have a particular position, then we can probably discuss it further. But the annual meeting is in May. Actually, it's the last week of April, so maybe by the May meeting, we may have more to say on it.
I know him quite well, by the way. Of course, I think I know most doctors quite well with all the physical problems that I've had, heart and cancer and so on and so forth. He's a good man. You mentioned Arizona. Is that a New Mexico? A law from New Mexico?
It's New
or-
Mexico.
New Mexico.
Oh, okay.
New Mexico.
New Mexico.
Well, I did a little background in helping Dr. Corey craft a particular ask or a piece of a work product that asks the society to do something. But in the process of looking it up, I found that there's about 30 states that, to varying degrees, recycle nursing home drugs from patients who die, oncology drugs from patients who either don't tolerate or can't take or unfortunately die during the course of their treatment, and then other pharmaceuticals as well. But the thing that's common to them is that it doesn't involve narcotics. It usually requires that the package be unopened, sealed, and that there be some sort of a certification from a professional who can say that this product hasn't been tampered with. And then there is always an informed consent on the other end. The patient has a right to know that they're getting something that maybe has left the chain of custody.
And perhaps this is not the time to talk about it, but I know that some countries actually recycle medical apparatus such as pacemakers and so forth. Matter of fact, I think you may have told me that a period of time ago. Someone did.
Yeah, I think Germany recycles pacemakers. If you get a pacemaker and you die before it's
Yeah, you were
not
telling
working
us.
anymore, it gets, they refurbish it, kind of like the way you would buy Bose headphones refurbished.
What are they, 45, 60,000?
I think they clean it up, they kind of like take that air and they spray the air on it and they reimplant it in somebody else.
They're on eBay.
Yeah. So it's, But, you know, I mean, it literally is, it's billions of dollars of these valuable pharmaceuticals get thrown away. And so we're just looking at a way to repurpose them so that they can maybe have another chance of getting used for somebody who might not have access. So we'll see how it comes out. But I think it's a worthy idea of discussion and debate. And right now, we don't have any mechanism to recycle it, so they just get thrown out.
And we get calls all the time here at the office. We actually just, I think earlier today, right? Somebody came in,
Yeah.
unused medications.
I had a fellow I was taking care of maybe 3 or 4 years ago who had esophagus cancer, and he had a tube in his stomach so that he could eat, and he unfortunately died of his disease. His wife had cases and cases and cases of pharmaceutical tube feeding formula, and she asked me what to do with it. I'm kind of like, I don't know. It's hard to donate this stuff because there's nobody willing to accept it once it's left a chain of custody for lots of reasons.
Yeah, I mean, the pharmacy people, I would just tell a lot of the people, if you have any drugs you're not using, pharmaceuticals, they would bring it back to me. Because what I would do is send it out for destruction. I had a mechanism to do that.
Well, that's a different discussion because we do have the kiosks in the police stations, so that if you do have unused pharmaceuticals, and the other thing that I learned is I think almost every town and city has these now, where you have a place to bring unused drugs that you don't need, particularly narcotics, if you have extra narcotics, because if they hang around the house, you know, people break into houses to steal them and things like that. Open houses, you know, people look they look in the medicine cabinets. I mean, it's really it's a huge problem. So you know, some of those drugs do need to be destroyed.
A lot of people just throw them down the sink, down the toilet.
Well, then they get into our groundwater.
Right.
Well, it goes to GLSD and then ends up in the Merrimack, and
I think if people have controlled substances at home, we talked about this on the opiate meeting that Joe and I went to last year. I highly recommend people put any controlled substances or even their drugs in a lockbox so that it's unavailable to anybody.
Yeah.
There's no need to put it in the medicine cabinet. It's available to everybody then. Lock it up.
Yeah. Right, one last thing. I got the annual report from Wheelabrator, from Tech Environmental, who did their review. I didn't know if if they've ever been in here to do any type of presentation or discussion about the annual report and the testing. Okay.
We've been over there.
We've been over there and we've received the report
Okay.
physically and looked at it or looked it over. In fact, I think I may have 1 or 2 of the notebooks in my basement, but
Okay.
they haven't, it's been quite some time since they've come in and given any sort of a presentation of it.
Okay.
When we went over there, it was more of a tour than a
Yes,
technical
yeah.
visit.
But yeah, I just got the annual report. I just spoke to Tim earlier today, and I said I would talk to the board if you guys want them to come in to go over the report, to discuss it, to discuss their...
Excuse me, before you came aboard, I would look at those reports. I had been the general manager of that plant, I don't know if you're aware, like 30 years ago. So I'd always look at any information provided to our board by the Wheeler
Forward this to you, or I
plant.
can give you a hard copy, whichever one you want.
No, I'll take a look at that, that'll be fine.
They're mentioning that, there also are regular reports that are supposed to come in from TBI.
Yes. Yep, we get...
You get those?
For the TBI? You get them from Tech and from Wheelabrator.
Isn't there an
Well,
air quality report?
That's the...
That's
yeah,
air quality.
yep.
You have the Wheelabrator, but there
Yes.
are reports, I don't remember if they're quarterly or what the frequency is, but something from the site assignment is to be generated from TBI.
Yeah, I'll definitely look into that.
Boy, that was a long time ago.
All the specifics.
Quarterly?
Don't quote me on that, and I'm pretty sure there's a regular,
Okay. I can look into that. I don't remember getting from TBI. I do get them from Wheelabrator on a regular basis.
Look at what, the site assignment? It would be in the
that's what
site
it would be,
assignment.
that's what,
Yeah.
there was something that we put in there, yes.
Okay.
Or that was part of our Yes.
All right, and that's it for updates that I have in various discussion topics. Anything else you guys want to talk about?
I think I'm good.
We're still in the winter, but I'm wondering how the flu vaccine worked this year compared to some of the other years that didn't work that well. I don't know if you read anything. I haven't read anything about it.
Anything that didn't work?
I haven't seen anything
Would
in
lead me to
pharmacy.
believe that it
What I
worked?
saw was that there were some notices that the overall effectiveness of it this year was a little bit less than
What they hoped for?
than what it generally is. And in fact, it's not, although the goal is 100%, and generally it never accomplishes 100%. And it may even be that the usual rate is a 60% control, but when you have a herd control, that's a very good number. But that was lower than that this year. I don't know, Frank, if you saw anything like that, but
It's like 50-60% this year. It's
Yeah.
not particularly good. We're still seeing it. People have been hospitalized with influenza, and, we're putting them on Tamiflu.
I know last year was very bad as
Yeah.
far as the effectiveness.
The problem is they have to guess like 18 months ahead, what the likely strains are, and they don't guess, they have a formula, but they try to predict, and the predictions are not always perfect. What I usually tell people is I've been getting the flu shot for close to 30 years now, and so, and the immunity does wane, but I think if you get it consistently year to year to year to year, you'll be better protected than somebody who gets it infrequently or never.
What about the pneumonia shot? I know someone that has pneumonia right now that had a shot. What's the effectiveness of that shot,
So
do you know?
the shot only protects against the strains that are covered, so the Prevnar 13 covers 13 strains of pneumococcus. You can get a pneumonia from a non-pneumococcal bacterium or from a virus, so it protects against common things, just the way the cervical cancer vaccine prevents common strains of HPV. So, the issue really is the vaccine prevents only the things that it's designed to prevent. It doesn't prevent anything outside of that. I see people all the time who have a diagnosis of cancer and they say, I've had blood work. And I'm like, yeah, you had blood work, but you didn't, they didn't test for what needed to be tested. You only get what you order. So the same thing when you provide a vaccine to somebody, you only get protected against that one particular thing. Pneumonia is basically an infiltration of the lung with an infective organism. It can be caused by a pneumococcal type of bacteria, which the vaccine prevents, or it can be caused by something else that the vaccine might not prevent. So it prevents the common strains of pneumococcal pneumonia, which also can cause meningitis, they can cause invasive disease. I mean, these things can kill people, so it's a worthwhile vaccine, and if you're over 50, you should get it.
And that's once, twice a year, a lifetime?
No, I'm not up on that. I think it's once every 5 years or
Once
something.
every
I
5
thought
years?
it's every 10 years, I thought.
Maybe it's 10 years. Don't quote me on that.
But you can get pneumonia from a bacteria, again, outside of the common strain, from a virus, and even from a fungus. And if you didn't get the vaccine against the particular strain that you got exposed to, then it's sort of zero protective, but it's a matter of, you sort of put a cost-benefit analysis, not even on the cost, but the ability to incorporate multiple strains into a single vaccine.
Just like the flu shot.
Mhm.
It's like life. There's no guarantees.
Yeah.
None of us gets out of here alive.
Plus your body's innate ability to mount the response to the vaccine and sort of set up protective capacity in your system.
It's a great point. If you're on a medication that suppresses immunity, you're not going to respond well to a vaccination.
So just stay inside those fatigues in the helmet and just...
Yeah, that's all, bro. I find that lining the baseball hat with tinfoil really helps, too. I think we've said enough.
Frank, is that like a Faraday hat, like a Faraday cage?
Yes.
Is that what you're thinking?
That's
Okay.
kind of along the lines, yeah.
All right, so yes, I think we've said enough. So
All right, so I don't have
Get
anything
in
else for
trouble.
we're
updates.
not trying to talk the populace out of getting a reasonable vaccine.
So there is a town election, when?
Next Tuesday.
Next Tuesday. Got
Yeah.
everybody go out and vote.
Exactly.
That's right.
Brian, a quick status update, is this farmer's market, should we have a start date in place for this? I've seen this, but I wasn't here at the last meeting when you had a nice presentation, so,
I want to say, I forget off the top of my head, I believe it's the end of June. I want to say like June 25th, I believe. And it's going to go through into October. So every Sunday, farmer's market right on the corner of, I believe it's Main Street and First Street. They're going to block off in front of Dr. Riz's office right there, and then Star Pizza up to the CVS. That section right there is going to be all the farmer's market.
the kind of along the side of the parking lot.
It'll be actually in the street. They'll block off the street from Main Street up down to CVS. So right there will be all the vendors, and there'll be a lot of really good things, I think, coming through. I haven't gotten the full list of vendors yet. I've been working with, obviously, the Merchant Association, the Field de Collegiero, to get our part of it lined up with our food inspections, vendor registration, and all of the basic checks of the food vendors themselves, all the credentials, their existing permits, their ServSafe, their allergen, things like that. So far so good. There's a lot of buzz. There's really good buzz about it. People are really excited to have it. So there's definitely some excitement.
You know,
It's really
these
good.
farmers markets are gaining popularity, and they do well. I mean,
Yes.
we go to the one in Newburyport all the time, and it's generally packed. You can sometimes hardly get around.
Oh, good. So yeah, people are really looking forward to it. I think it's going to be a big success.
Okay, very good.
Thank you, Brian.
No problem.
Okay. As they say, a motion adjourned is always in order.
Move to adjourn.
Second.
All those in favor?
Aye.
Aye.